Hi everybody, here we are on August 3rd, 22 weeks into the COVID pandemic, and I've come to talk to you about phase 3 recommendations starting tomorrow. That's why we're talking today. Starting tomorrow, Tuesday, August 4th, we will be in phase 3 of the Path to Regain Home, which is very exciting on one hand and scary on the other hand. So you're going to get in your mail today a grid that looks like this. It has information on both sides for all 3 levels of care. I worked on this weekend so that you can look at whatever level of care you're in and you can see what the recommendations are. You're also going to get a cheat sheet from me, a tip sheet on what residents can do with visitors and what visitors can do. So please share that information with the people that you would like to have come visit. So if you're in independent living, I am just asking you to limit the amount of visitors that you have to 2 people at a time. They need to screen in at the desk, either the main entrance or they can screen in at the spring entrance. They have to pass the screening questions. They have to not have a fever and not have been in contact with anyone who's been around somebody with COVID. If they pass all of those questions, then they can come in for a visit. They go from the screening table straight to your apartment, and they can visit in your apartment, and then they go straight out of the building. We're not going to allow visitors at this point in any of the common spaces. So no dining rooms, no libraries, no group rooms, no community rooms. So the visitors are just welcome to come to your apartment. We're going to count the space outside 3rd on 3rd as a dining venue, and so we don't want you to have visitors out there either, because for every person who wants to have visitors at Oaknoll, there's another person who doesn't want to have visitors at Oaknoll, and we have to make this safe space for everybody. So if I want to go eat at 3rd on 3rd, I want to be assured that there's nobody at 3rd on 3rd that doesn't live here. So if you have any questions about where your visitors can be or how many visitors you can have, you can give me a call. I also want to let you know that we're not having children come in yet. So your visitors have to be over the age of 18. And that's because really how this virus impacts children isn't known. But children do tend to spread viruses. They don't wash their hands well. They can't follow directions necessarily. They don't wear the face mask or their face shield. So there are just a whole lot of considerations with kids that I'm not willing to take on just yet. First, we'll get through this first phase of having visitors in and see how we do. I don't expect any trouble. I'm nervous giving up some control. We've had a lot of control of our environment while we haven't had any guests in, but we've also had people getting lonely and missing their families. And so we're trying to strike a deal in the middle. So if you're in assisted living and the health center, you schedule your visits with Lindsay Reed or the recreation department. We're also going to limit those visits to 2 people, and we're going to limit it to 2 times a week, just because we need to supervise all of those visits, not closely, but we need to make sure that you're observing social distancing, that everybody's wearing a face mask and a face shield, and that nobody's been around anybody who's been sick. And finally, I'll ask that you make sure your visitors are not unwell. So we don't want anybody to come in that even has a sniffle, because one of the symptoms of the coronavirus is sort of a snuffly nose. And so if anybody is feeling unwell or feeling like they might be getting unwell, they should not come. That's a lot of information for everybody, but it is something to celebrate to have visitors back in, even though the case counts in Johnson County are higher than I would rather like them to be. They're lower than they were 2 weeks ago. And so there's still a downward trend in the cases. We have fine staff. We don't have any trouble with staffing, no trouble with PPE, and the hospital, I think the university was reporting 25 people inpatient this morning, and they have capacity for more. So we've met all the metrics to move forward. So we're going to move forward cautiously and excitedly to welcome visitors. If you have any questions once you go over the paperwork that is in your mailbox today, just let me know, reach out. Otherwise, I won't do my video on Wednesday, and we'll see how things go. What will cause us to go back to phase 1 is one other question I wanted to answer. And so if we have anybody who's positive for the virus in our community and another person who is symptomatic, we will shut things down and we'll go back to phase 1 and we'll start over. So enjoy your visitors while you can and before the students get back to town, and we'll see how we're looking in a couple weeks. Thank you. Take care.